O'Connor from the Center for the Study of Social Policy. Thanks for joining us today for our Strengthening Families Networking webinar. Our topic this month is childcare after the American Rescue Plan, which I know is a topic on a lot of people's minds. So to just give a little bit of context for this series of webinars, in case you're not a regular, we do this each month. It's an open invitation to anyone who's using the Protective Factors Framework or coordinating Strengthening Families efforts or just interested in the topic of the day. We jointly convene these between the Center for the Study of Social Policy, or CSSP, my organization, and the Children's Trust Fund Alliance, where we're joined by Maureen and Lucretia today. And each month we choose a different topic, guest speaker. We coordinate those, but we always welcome suggestions and volunteers from among the network. And all of the recordings and materials are posted on a site that the Alliance maintains, where you can find the videos of the recording as well as the slides and any handouts. So those will be posted by early next week, and you're always welcome to access those. I just put the link in the chat. We do this on the second Thursday of each month at this time, 3 o'clock Eastern. On May 11th, we'll be hearing from members of CSSP's Parent Leader Network. That registration will be up soon. They'll be talking about some of the successes that they have accomplished in their work in communities. Then we've got great topics lined up through the summer. I can't believe we're already looking at summer dates in our next few months. And those topics will be announced. We send those out in the Strengthening Families newsletter, post them on our website and on that Alliance site where the archives are posted. So you can always find that information. But the easiest way is to make sure you're signed up for our newsletter so that you get that notification each month about what the topic is and how to register. But you might as well go ahead and block the time on your calendar, second Thursday of the month, 3 o'clock Eastern. And then if you aren't interested, you can take it off your calendar. But that way you're ready. So please join us as often as you care to. For today, we are excited to hear from members of CSSP's policy team. So some of my colleagues are joining us today to talk about childcare after the American Rescue Plan. I'm very grateful that Ellie Kaverman, Alex Kocha, Essie Hutchful, and Elisa Minoff are all with us. And I'm actually going to hand off to them. I realized I didn't even say all your titles. They are all brilliant, wonderful people on our policy team. You will hear from each of them and get to hear about the work they've been doing and what's going on out in states and with families about childcare these days. So with that, I am going to stop sharing and hand off for our policy team to share and present with you. Thanks all for being here.
Thanks so much, and it's great to be here. Today we're going to talk through some of our research on the childcare sector and the impact of pandemic era funding, and have some time to talk about where we go moving forward. It's not news to any of you on this call that the childcare sector is still teetering on the edge after all but collapsing during the pandemic, as many childcare programs shut their doors and staff left. There is still a huge shortage of childcare providers in this country. And part of the reason is many providers during the pandemic didn't feel safe caring for children anymore. Some left for higher paying and less stressful jobs outside of childcare. So there's still a huge amount of work we need to do just to get back to where we were before the pandemic, which itself was not a good place. The situation we find ourselves in is really a result of chronic underinvestment in childcare. It's a product of decades of policy decisions rooted in the undervaluing of caregiving and failing to recognize the critical work of childcare providers, who are overwhelmingly women and disproportionately women of color and immigrant women. At CSSP, we see re-envisioning and reinvesting in childcare as central to turning the page on this history of undervaluing caregiving, and ultimately really central to advancing racial and economic justice for families. So today we're going to be talking through our findings from qualitative and quantitative research in states about the impact of the temporary investments made during the pandemic, and specifically under the American Rescue Plan, and the impacts of the child care investments in particular. And at the end, we will talk about what states are doing now to sustain those investments. We are interested in learning and hearing from you if you have any information about what your states are doing to sustain investments, and then having a bit of a discussion about what what sorts of investments are really necessary in order to build a childcare system that really does work for families and for providers. So before we dive in, I just want to provide a little context for this work. So in 2021 and 2022, we conducted research to better understand the impact of the American Rescue Plan investments in families and communities of color. And we did research specifically looking at the child tax credit and child care investments. And today we're going to be talking about the child care investments. We wanted to learn from families with low incomes and families of color who've too often been excluded from supports in the past, both by the way the supports have been designed and the way they've been implemented. And so we looked to do research in 4 states that were chosen in part because of their geographic diversity. You see here, Michigan, Mississippi, North Carolina, Arizona. And in part because we knew we would be able to interview and talk to many Black and Latinx families in these states. And in part because in these states all have relatively high child poverty rates. And they fall in the bottom half of states according to the Kids Count Child Wellbeing Rankings. So these are all states where these sorts of investments in families with children are really critical. We conducted in-depth, semi-structured interviews of parents and caregivers of color with incomes under $55,000 a year. So that's income under about twice the federal poverty line for a family of 4. We also interviewed child care providers. We interviewed other stakeholders in the child care system, including state advocates and state officials. And finally, we surveyed families. So ultimately, we reached over 1,900 parents and caregivers with our survey. These parents and caregivers hailed primarily from these 4 states, Michigan, Mississippi, North Carolina, and Arizona. But there are some respondents from other states as well. They were disproportionately low income and disproportionately people of color, and especially Black families. So we're going to go through our findings on childcare today. But I wanted to just flag that if you are also interested in our findings on the child tax credit, those are all available. We have links at the end of this presentation. We also have a special website or part of the CSSP website, which I'm going to drop in the chat right now, that has all of our findings related to the child tax credit and a child allowance. So with that, I will pass it off to Ellie.
Hi, everyone. It's good to be with you today. So as Elisa mentioned, we're going to share a little bit about the childcare sector before the pandemic, which Elisa mentioned was not already in a good place. And then when the pandemic happened, the bottom kind of fell out. So we'll share a little bit first about really what the childcare sector looked like before the pandemic. So even before COVID, the childcare sector was struggling. And that was really largely in part because of chronic underfunding for the sector. And it's difficult for both families and for childcare providers. It was a struggle for everyone involved. For families, the struggle was really around trying to find available, affordable, quality care that matched families' needs. So the difficulty laid really in trying to find something that met needs in different ways. So that includes everything between trying to find childcare that was in your area, that wasn't too far away for you to be able to get to with everything else. So like location was an issue, something you can actually afford to pay for. Affordability is an issue. Childcare that offered the vision of enrichment that parents would want for their children. And also, in addition to that, it was the culturally responsive care that a lot of parents wanted for their children. So it was really difficult to find childcare that met all of families' needs even before the pandemic. And on the provider's side, it was also difficult for them because of the chronic underinvestment to really keep the doors open and make ends meet. Because childcare providers historically have low pay, it's really difficult to maintain workers because it was low pay, long hours, really stressful work, but such important work. It's a sector that's kind of been able to sustain itself because of the passion of the people who work in the sector, but it's been difficult to retain that workforce because of the low pay and the long hours. We even talked to one family, a parent during our family interviews, who shared with us, she herself was an early educator, and she talked to us about how she was working 2 jobs, both in early education and childcare, but she had to work both jobs to be able to even make ends meet for her family. So for both families and providers before the pandemic, it was just really difficult. And I'll share a little bit more here in the next slide for families. So because childcare was really so difficult for families to secure and rely on, and childcare, I would say, that actually met their needs. So their needs, location needs, their specific like needs with what aligns with what they need. It was really hard for parents and families to actually find that. So in our survey, we actually found that 77% of our respondents said that they had reduced work hours because of childcare challenges in the past. That's 3 in 4 of the parents and families that we surveyed. So it's clearly an issue. It's clearly an issue to secure childcare for families. And it's really important to note that that is directly tied to the lack of accessible, affordable, quality care that really aligned with what families need, and the diverse array of what families need too, when it comes to childcare. And I touched on this already, but that includes everything from, families who don't speak English, but there are only English speaking childcare options in their area, or families who need care for children with disabilities. There's a lot of different reasons why childcare options were really hard to find for families before the pandemic. And for providers, like I said, it wasn't great either. In the next slide here, I will, for providers, it was a struggle before the pandemic to just keep the lights on and the doors open. We spoke with Nicole, who is a home-based childcare provider of over 20 years in Mississippi. She shared with us that she knows her community, and she knows that she can't charge the parents in her community what the actual going rate for childcare is, because she knew where they work. And they work in low wage jobs that don't have the wages that would meet the going rate for childcare in her community. So for example, in her community, the going rate for childcare for infants was $100 a week. So she set her rate at $90, and then she eventually had to drop it to $80. And because revenues were so low for her, Nicole actually does not pay herself a salary at all for her work. And she has 2 employees who are paid $8 an hour and don't have any benefits like health insurance or any other benefits that can come with employment because the revenues are so low. Nicole also shared that her center was able to stay open through the reimbursement of just 5 children who attended the center and had subsidies that reimbursed for the payment. So as you can see, for both families and childcare providers, it was already a bad situation. And then when the pandemic hit, it really just made a bad situation much worse. And I'll share a little bit next about another childcare provider who talked to us about what it was like when the pandemic hit and really the impact that she felt. So Caroline is a Michigan home-based provider of over 3 decades of experience in the childcare sector. And she spoke to us about the impact on her business. And she said that following the pandemic, when the pandemic started, she'd had almost 2 years of lower attendance and had lost $30,000. So just really the bottom falling out of Caroline and the childcare sector really overall. She shared with us, I was literally paying to work 60 to 70 hours a week. I was paying out of my savings to care for other people's children. I think that's why so many providers just couldn't do it. You can't survive when you're working in negatives and working 60 to 70 hours a week and not being paid. I was paying to go to work every day. So you can see how really when the pandemic hit, it made just a bad situation much worse. Thankfully, what happened were some temporary investments made in the childcare sector because of the pandemic, which I'll pass over to my colleague Alex to share a little more about.
Thanks, Ellie. And really just to get in the numbers for folks, obviously recognizing this need that was due to this chronic underfunding, but recognizing it as sort of a pandemic related need, Congress did act. So in spring of 2020 passed the CARES Act, which had that should have a billion next to it, not $3.50, but 3.5 billion for the CCDF supplemental funding. And then later that year in the consolidated appropriations, there was another 10 billion. But ultimately, when we got to March of 2021 and recognizing just the need that providers continued to have, there was an investment of close to 40 billion, much of which was for child care stabilization grants. And that was focused on getting money directly to providers to stay open, to reimburse costs that they had incurred during the first year of the pandemic, and to maintain being open in those slots safely. And there was also additional funding then that states could use in the child care and development block, through the child care and development block grant, through that program. Ultimately, based on the numbers that we have currently through 2022, 220,000 plus child care programs received stabilization supports, and that covered as many as 9.6 million children. About 8 out of 10 licensed child care centers received assistance. But I think important to note the difference in terms of the type of grant, the amount of that grants would be given. The average award for centers is about $140,000, whereas the average home for family homes, the average award for family homes, as you can see, is just a lot less. And so I think this investment through ARPA was obviously a recognition of both the endurance of the pandemic and the drastic need to meet that stabilization goal because of years of underfunding. And so with ARPA, and this will get us into the later portion of the talk, states have until later this year to spend the stabilization grants, and then until 2024 to spend the CCDF funding. And so a lot of states, as they have been thinking about what comes next, are obviously concerned about those deadlines. But wanted to show, that this money did get out. 220,000 child care programs received it. It covered kids, and that obviously had an impact on families and providers, which is really what we want to highlight through the research that we did. So I'll pass it back to you, Ellie.
Thanks, Alex. Thanks. So we'll share a little bit more about really the impact providers and families shared with us of these pandemic investments that were temporary. We can go ahead and go to the next slide. So really the ARPA investments helped to stabilize the childcare sector in the midst of the pandemic. The sector, as it was already not doing well, but it helped to just stabilize it and stop it from falling apart, really in such a moment of crisis. And it really was a reaction to the crisis, right? So the investments in childcare really helped families to access affordable care and help childcare providers stay open. And especially for providers who received the funding and who received it quickly, it really was a blessing. Many of the providers we talked to told us it was a blessing. They used it on all different kinds of things in their businesses, including helping with fixing repairs, like fixing their different kinds of equipment that they needed to get repaired, helping to replace other kinds of equipment that they have, whether that's toys for the kids or educational activities, replacing all of those types of things. Other providers used the funding to invest in their staff and invest in their people, helping to pay for trainings and helping to, in some cases, offer short-term pay boosts or bonuses. The child care funding really helped providers to stabilize and to just survive the moment, really. It also, a big piece of this too that came out in our research talking to childcare providers, there was part of this funding that was tangible in going to help providers afford to replace things, to do the staff training, to do that part of it. But another less tangible piece of it is that it brought out a newfound respect for the profession that many childcare providers had just never felt that they received from the world, really. And it just helped them feel recognized for their critically important work for the first time, which I'll share a little bit more from a childcare provider named Barbara, who's a home-based provider in North Carolina. Really, the influx of investments, even if they were temporary, it was a symbol of some newfound societal respect for just the importance of early education and the people who work in those sectors. Barbara shared with us, I'm thinking, oh, wow, so now I'm essential. Now you see the importance of early childhood educators. We're the foundation of early childhood education. We also talked to some other providers who were very explicit in their role as early educators in supporting the rest of society so that parents can go to work, so that everyone else can do their jobs. Childcare providers are the foundation of really the economy in so many ways, excuse me. I will say another piece that came out in the interviews with childcare providers, it was this newfound recognition and respect for them. There were some, it was a bit tempered around the temporary nature of these investments. Fears around the benefit cliffs and sustaining investments, really, how would you sustain investments after this? So it was interesting to have both sides kind of come out, both excitement at this influx of investment and excitement that, you know, their profession was really seen as so critical for the first time, but it was also met with some worry and concern about what would happen after. And for families, excuse me, for families, I'll share a little bit too about the impact for them. So in our research, when we spoke with families, it was a bit early in the rollout process for the funding. So to some extent, our understanding of the impact is limited just because of when the interviews were. But we did do our national survey, and we asked explicitly a couple childcare questions, including whether support for childcare for their family had increased since the pandemic. And 55% of families reported that childcare support had increased from the state since the pandemic. So you do see that impact on families too, that families were getting more support from the government to afford childcare. And often that looked like the state, you know, reducing or eliminating family copays or family fees for childcare, and also expanding subsidies to more families in states. So both providers and families really did feel the effect of these childcare investments in pretty profound ways. And it was really a moment of crisis where these funds helped sustain families and providers through. We also did learn some lessons about how the administration of these funds actually really do matter. So I'll go ahead and pass it to Alex to share a little bit more about that.
I think as Ellie was saying, you know, a lot of states did sort of converge on some of the same types of policy decisions, for example, around beginning to reimburse providers based on enrollment rather than attendance, right? There was a big effort among a number of states to do that. But the reality is with funding like the stabilization grant that goes to the states, like the Child Care and Development Block Grant that goes to the states, is that because state rollouts are different, that's going to lead to different outcomes. One example of how states, you know, decided to alter what they did in terms of investments was how they designed or how they thought about the stabilization grant formulas to determine, you know, which providers get a certain amount of money. And so some states decided to reimburse or you know, give kind of bonus points for providers that did out of normal hour care or did serve you know, individuals with disabilities. They could make decisions of where money goes based on those types of formulas. And some states decided to to use it as an opportunity to try to get the childcare sector to be invested in a little bit more than just at a stabilizing level. So for example, North Carolina thought about how in their reimbursement and then the stabilization grant program, you might get more as a provider if you build in salary increases rather than just a one-time bonus for childcare staff. But these, states did take a lot of different approaches. Some states decided, that providers couldn't get new money until they had closed out the previous grant, and that reporting process might take a while, and so providers weren't able to get the money that they needed to stay open. So because it would go to the states, because sometimes states were worried about the fact that it was temporary funding, this would create a lot of roadblocks, and it made the process difficult. One thing that we really recognized from the research is that what those policy decisions look like matters a lot at who's at the table and which stakeholders are involved. And so there's a few lessons learned that we want to share about that. But ultimately, these states, providers and families had fears about the sustainability of funds and what's next. What we found was that engaging communities in the decision-making process and in the feedback process not only creates better outcomes in terms of where funding goes, but it also can build a level of community buy-in and infrastructure that can help with sustainable efforts down the road when more funding is available. This is, perhaps a truism, but obviously we know that building trust between stakeholders and policy leaders, it takes time, but it yields more effective policies. In states where providers had, feelings of chronic disrespect, were worried that they might have to pay money back or be under very strict scrutiny of the state, and that might lead to not applying for grants, and obviously that would then affect the outcomes of the families who use that provider. Developing the partnerships helps with implementation because you're able to get information out through existing networks. You're able to reach communities through trusted actors that the government might not be aware of, or the state government or agency might not be aware of. In North Carolina, for example, there's an existing childhood network called Smart Start Network, and North Carolina, the agency, Health and Human Services, was able to utilize that network to get information out and improve implementation, and also develop kind of a feedback loop with providers that way. That said, we also saw that philanthropic investment was really crucial to building some of these stakeholder engagement infrastructures. So in Michigan, we saw a lot of philanthropic investment that built out community feedback models that really helped with regular engagement with a state agency. One thing that we saw in Michigan as well that was incredibly beneficial is that you had a lot of buy-in and leadership from the government, the governor's office, and at the cabinet level. And that's really, leading from example there is really crucial to both getting the funds to where they need to go and showing the child care sector that it is an important one and requires investment. And then because of who's involved, we found that really stakeholder engagement is a way to advance economic, racial, and gender equity. You get the perspectives of people who aren't necessarily at the table at the agency level, who are talking about the barriers that they face as providers and as families for meeting their child care needs. And that's going to influence the decisions of where money goes moving forward. This type of stakeholder engagement is really crucial for long-term investments, and that was a big takeaway from the research. But there's obviously a fear. This was consistent across the interviews of what's next. So this is a provider in North Carolina who expressed, we're making all these strides, we're implementing these wonderful things. What happens when the funds stop? Are we no longer essential when the pandemic is over? Recognizing that this can't just be about targeted, temporary pandemic-related investments. This has to be something that is continued and that states can rely on, and therefore providers and families can rely on. So what we want to talk about now is, what does it look like for states who are thinking about what comes next? And so I'm going to turn it over to Essie to talk about that.
Thanks, Alex. So as Alex said, right now, after having talked about how important these investments were for families and providers, everyone's really worried about what is going to come next. According to the Bipartisan Policy Center, their estimates say that states are facing a combined total of $48 billion in funding shortfall once federal child care funds expire in September 2024. And in terms of public financing, ultimately, what we need is robust federal funding, particularly as states, unlike the federal government, are required to balance their budgets. However, though they are relatively more limited in their ability to finance childcare, they do have options that they can take to move forward. So right now, what I'm going to do is offer just an overview of some of the different approaches and considerations that states are making looking forward. And it's going to be far from a comprehensive review. And at the end, we'll look forward to hearing from you all about what approaches you're seeing across the country. So I'm going to start by looking at what efforts we see states making. One approach that they're taking is just to simply try to maintain the investments that have been made since the pandemic. So in North Carolina, for example, we see that the state is currently discussing how to extend the portion of stabilization grants that they put towards provider compensation and fixed costs. The state's bipartisan and bicameral early childhood caucus in the legislature has proposed putting $300 million in one-time general funds for the coming fiscal year to extend this aspect of compensation increases to providers. The governor responded in his budget proposal with $500 million for the same purpose. Again, these are one-time funds that would need to be maintained in future years if they were approved. However, neither of these proposals have been yet adopted by the state house when it put out its own budget proposal. And so it remains to be seen if the Senate, when it comes out with its budget proposal in future weeks, it remains to be seen if those proposals will actually make it in budget negotiations. In Arizona, part of their funding that they received from the federal government was put towards increasing provider reimbursement rates. And right now, one of their primary goals is really trying to calculate how much it would cost the state and its general fund to be able to just maintain those increased reimbursement rates. And that is, again, their primary goal in a state that previously had really limited childcare investments. In Michigan, we see that Governor Whitmer proposed in her budget proposal is calling for $73.5 billion federal CDBG funds to maintain increased eligibility that they had during the pandemic for child care assistance for families making up to 200% of the federal poverty level and to maintain increased provider reimbursement rates. So those are just a couple of examples of how we see states trying to maneuver to just keep themselves level once federal dollars expire. If you could go to the next slide, please, Alex. And then another theme I wanted to talk about is where we see areas where we see states are looking to actually move past just maintaining federal investments and looking to advance support in the childcare sector beyond even the pre-pandemic status quo. One prominent example is New Mexico. In recent years, as folks may have heard, the state has really taken great strides in the early childhood space, including implementing a new cost estimation model to better reflect the true cost of care for childcare providers, amending their constitution to ensure $150 million annually for early childhood, and also seeking to waive childcare co-pays for parents up to 400% of the federal poverty level, at least for a year through to June 2023. And then in North Carolina, that early childhood caucus that I mentioned earlier put out an entire slew of proposals, some, as I said, to just maintain investments, but some to advance them, which would include $24 million proposed recurring funds for higher subsidy reimbursement rates to providers, implementing a statewide subsidy floor to eliminate variation county by county and what providers can expect, reducing the child care wait list, and also proposing to create a pilot for a new funding model for childcare based on the Michigan model that splits costs between parents, employers, and the state. Now, unlike the proposal regarding compensation to providers, a number of these proposals were actually picked up in the state house budget, which is promising. This includes the plans to reduce the child care wait list, the cost sharing pilot, and also the plan to increase provider rates by setting them to the more recent 2021 market rate survey. However, there are still disagreements between what the Early Childhood Caucus proposes and what the House final budget proposal was. For example, the Early Childhood Caucus was calling for the increase in provider rates to not just be set to the 2021 market rate survey, but also to then be increased automatically based on future surveys. And again, for the statewide floor, in the House budget proposal, they took out the element of automatic increases and the element of the statewide floor. So there are a number of those advancements proposed, and we'll have to see what happens in budget negotiations. And in Mississippi, we saw in Governor Reeves' State of the State and his budget proposal a call to remove a current requirement in the state where parents who are seeking child care assistance are currently required to participate in the state's child support enforcement in order to qualify for child care vouchers. And the consequence of that policy is that the state currently only serves, according to its estimates, about 21,000 children versus its capacity for 120,000. So the governor is calling for the removal of that requirement and also for the creation of new child care tax credits for parents to defray the expenses of child care and for child care supplies. However, there is a potential disadvantage to that tax credit proposal, because it might disadvantage the lowest income residents who are disproportionately people of color, particularly for those who may have incomes that are too low to require them to file taxes, or who may be immigrants who are ineligible for the state's tax credits. So that's sort of one step forward, but also back there. And then, there we go, thank you. I also want to highlight, looking at the approaches that I just talked about, there are a number of ongoing challenges that we can see states really wrestling with. For one, most of the proposals don't account for any new dedicated long-term funding streams for the early childhood system, and instead are still relying on one-time funds or federal funds. So for example, the dueling North Carolina proposals around increasing provider compensation, that proposal is still just for a one-time investment. There aren't longer-term plans yet about what to do for provider compensation. And even in New Mexico, a state that has been lauded for its increased funding for early childhood, including that $150 million that was provided for in the amendment to the state's constitution, that money comes from fees on oil and gas. And as one advocate group called New Mexico Voices for Children noted, the state is currently too reliant on oil and gas revenues, which are really volatile and currently consist of a third of the state's general fund revenues. So that's not actually in the long term a particularly stable funding situation for early childhood, even though it's currently generating them a lot of money. Another challenge that we see is a continued reliance on the market rate survey over the true cost of care. So again, going back to North Carolina, the competing proposals from the Early Childhood Caucus versus the House budget proposal, those both still rely on rooting reimbursement rates on the market, the 2021 market rate survey, instead of, as some other states have done, trying to move forward towards a different cost model that better reflects the actual cost of providing care for childcare providers. In some states, we also see a continued disregard for what we call family-based care, or specifically family, friend, and neighbor care, or when childcare is provided by caregivers in their own home as opposed to a designated childcare center. Despite this being the most commonly used form of childcare in the state, in the country, only a small subset of federal subsidies or even ARPA funding reaches these childcare providers. And in Arizona, advocates noted that despite about 60% of their children being served in family, friend, and neighbor care settings, at least in the prior administration, there was a lot of resistance to using federal funds to support these home-based family care providers because of suspicion that they would be more fraudulent or less accountable, and they were really subject to more scrutiny than other providers. I also want to note that even as we're talking about the spending side of states' plans for childcare, really want to ask that folks stay aware of what's going on the revenue side of state budgets, because a number of states, even as they're calling for more investments in childcare, they're ignoring the part where they are expecting revenue reductions. So Mississippi, for example, the governor is simultaneously calling for the elimination of the state's personal income taxes. North Carolina, for years, has been trying to eliminate the corporate income tax and greatly reduce the personal income tax. And just to illustrate what this means, in the current fiscal year, there's an estimated loss of $1.7 billion from the personal income tax. And that's compared to estimated childcare funding cliff of $1.7 billion. So the amount of childcare funding that they need to make up is about the amount of personal income tax that the state has decided to forego. And then finally, I just want to take a note of the importance of thinking about how childcare investments are framed. So North Carolina, the governor has really rooted his support for childcare in the idea that the primary goal of childcare is to enable paid work outside of the home, even though we know that there are other reasons that childcare is beneficial to families. And in Mississippi, Governor Reeves has positioned his support for childcare as being primarily seeing childcare as primarily the first step towards his vision of creating an anti-abortion Mississippi. So it's really going to be important for advocates to try to navigate these waters and figuring out how to promote investments in childcare while trying to avoid sort of justifications that could hurt families in other ways. Next. So just to stop here, I'm a little over my allotted time, but just to sort of sum up what we've said around strategies for sustainability and the importance of these investments for families and childcare providers. So first, it's important to note, as Ellie and Alex said, that it's critical to maintain and strengthen community engagement. That was a really important aspect of what helped these federal dollars actually reach providers and families, and moving forward, that's something that's going to have to be a really crucial aspect of state strategies to sustain the sector. And then in terms of financing, again, those states are relatively limited, or limited relative to the federal government in terms of financing. They do still have a range of options to support childcare workers and families. These are just a few options they can look to. They're far from any one silver bullet, whether it's sin taxes or lottery dollars or tax credits, as we see Mississippi pursuing, tying early childhood funding to school funding, which is somewhat of what happened in New Mexico, where their gas and oil money previously already went to support K-12 schools, but was now expanded to include early childhood. States have a lot of options that they could look to if they wanted to be creative. But again, ultimately, we really need the federal government to come to the table with robust investments towards sustainability, which would be crucial to creating a really comprehensive childcare system that advances equity, that families and providers have told us consistently that is what they need. So with all of that information that we've given to you, we're going to move now towards Q&A, but we're going to do it a little differently. Before we open up questions to you all, we're going to start by posing the first question to you. So feel free to answer in the chat. But for those who are working on childcare at the state or even the local level, are there any sustainability strategies that you all are seeing advanced or proposed? And yeah, could you tell us a bit about them? And then we'll move on to, if folks just have questions you want to ask us, also feel free to put that in the chat. Let's see. And I'll ask my colleagues to help me. I haven't looked at the chat in a while, so I'm trying to catch up on all the comments. So David has a question about, do we feel that framing childcare as a post-Dodds obligation is going to work well for advocates in some states? The talking points in any legislation should probably both be introduced organically by the dominant party in each state. So I'll maybe take a stab at the first part of that and then open it up to Alex, Ellie, and Elisa. Oh, wait, no, sorry. The chat just moved again. Okay, so yes, regarding how to frame childcare post the Dodds decision. Again, as I mentioned in Mississippi, in the governor's budget proposal, literally, if you look through it, he frames it as pro-life agenda. I framed it as the anti-abortion agenda. But even before proposals for pregnancy resource centers and other things that are more commonly tied to abortion, literally number one on that agenda is childcare. So that should give a sense of how, at least in Mississippi, and I'm sure in other states that I didn't mention, the framing, that connection is already very clearly, explicitly happening. And I would say, and other folks can feel free to chime in, that framing is already happening. And so it I think would behoove advocates to not sort of shy away from engaging in that and talking about the general benefits of childcare for families across a range of aspects, but I would, Elisa and maybe Ellie, your faces looked like you wanted to say something, so I'll let you jump in.
Just to say that I think in the particular situation in different states might require like sort of unique responses, but at the federal level, it's very important, and we've talked about this with sort of our partners who do a lot of reproductive justice work, that it's really important to talk about both the right to an abortion and the need to keep abortions available for families, and that families should have the right to support and services that help them meet their basic needs, including things like childcare. So to try and make sure that there's sort of a recognition and a call for reproductive justice alongside calls to support families. And I think the specific state context might warrant different framing at times. But certainly at the national level, trying to push back against those who are trying to restrict access to abortion even further is important.
There was also a question typed into the Q&A that I think Elisa was going to respond to.
Yeah, so there's a question here about considering whether the specific grants to focus on Native American language, culture, and social practice might be made available. These sorts of grants could specify that staff would need to be sort of designated to support families. Programming would need to be developed, but it could be a model of sustaining federal investment that also addresses inequity in disadvantaged populations. So just a couple of points about the American Rescue Plan investments first, because I think they're worth noting. There is some focus at the state level and at the federal level on trying to make sure that money is going to support culturally responsive care. So at the federal level, I think we saw this with American Rescue Plan investments, that they did make tribal governments eligible for the funding, and so stabilization grants could go to child care centers on tribal lands, and so that was sort of one focus at the federal level. At the state level, we also saw a lot of interest in the states where we did research, especially in places like Michigan and North Carolina, an interest in making sure that family childcare homes are really supported by the stabilization grants. And that, I think that focus on getting the funding to providers, home-based providers, was in part a response recognition that home-based providers are often providing more culturally and linguistically responsive care than large centers. So even though, as Alex noted, centers generally receive much more funding because they're supporting larger, more children on average. Many states did specifically focus on getting the funding to family child care homes, which I think is also an interesting kind of approach in terms of providing more responsive care. One of the things that came out from our research and interviews with parents, though, is that that for many, they can't find culturally responsive care in their communities. When we ask parents about the childcare that they used, what kind of childcare they would like to use, we were interviewing primarily Black families and Latinx families. Some of the families we interviewed were immigrants, and very few mentioned childcare centers as being sort of their ideal childcare arrangement. They talked about wanting to send their children to be cared for by relatives, or smaller childcare homes that could provide care in the language they spoke, or that was close by to their home. And and would, serve their children the foods that they were used to eating, and be easy, where the relationship between the provider and the parent would be easy to navigate. So I think those are the sorts of things that we really need to be thinking about when thinking about what a child care system should look like in the future, is how do we ensure that childcare is accessible to all families, but that the childcare families want is accessible to all families.
Thank you. And I just want to say thank you to all our presenters. This was really important information that you shared. Did you have another slide with links on it that you still wanted to show? I know we've got great resources. We will include, well, you'll be able to get these slides. We'll also include links to all of those handouts where we post the video and recordings. So thank you all very much for presenting. Thanks for the comments in the chat and the Q&A. We're going to share a few updates from the Alliance and CSSP before we close out here. So Maureen, off to you.
Thanks so much. I just have a few upcoming events to share with everyone. The first is that we have 2 upcoming Alliance hosted training of trainers that are virtual. One is in May. I have a few spots left with that. And then the other is going to be in August, and we have special training times to be more inclusive for folks that are in Hawaii and Alaska. So we have gotten lots of requests for that. Lucretia is going to put a PDF in the chat box that will have all of these flyers for you. And then the next update is the Birth Parent National Network has an event coming up on May 10th. Partnerships and protective factors supporting parental resilience, and that is open to everyone. So that's it for me. Thanks, Kaylin.
Thanks, Maureen. All right, I'm going to share a couple updates from CSSP, and in addition to all the great policy work that was just shared, we've got a lot going on at CSSP, including that we're currently hiring for someone to be a program analyst working on our Early Learning Nation project. This role, while the title program analyst doesn't exactly say it, this role will really focus on parent leadership and nurturing groups of parent leaders to make change in their communities and transform how early learning is supported in their communities. So if that speaks to you, or if you know the perfect person for that role who's great at bringing together parent leaders from across the country, across all dimensions of diversity and different perspectives that parents bring, please send them our way. We would love to hear from a lot of members of our networks who are interested in this type of work. So excited about that. We also have a new page on our website called The New Neighborhood. If you've been paying attention, you may notice that name. That's also the name of a podcast that we've been doing for 2 seasons. The 3rd season will be coming out soon. So you can listen to those past 2 seasons, but also find a whole web of new resources, or actually a new place to find existing and new resources that are related to local early childhood system building. So check that out on our website under The New Neighborhood. And Joan Lombardi wrote a blog last week about this new part of our website and the focus and why we call it The New Neighborhood. So check that out. Joan has been a longtime partner and supporter of Strengthening Families and a lot of other work at CSSP. So we're grateful for her support for that. And our partners have some upcoming conferences, including the virtual conference for the National Conference on Child Abuse and Neglect, or NCAN, that's actually going on right now. It's a virtual conference. There were some sessions today and earlier this week, and there will be sessions next week as well. So you can still register. If you missed the first part of it, you can still join next week and access those recorded sessions that have been on this week. BUILD is having a conference in July out in Anaheim, and Prevent Child Abuse America is having a conference in Baltimore in August. So lots of opportunities to reconnect with colleagues who are doing similar work and passionate about all of these issues. These are some of our Strengthening Families national partners who have been steadfast partners in all of this work for many years. So we hope to see lots of you at those conferences. And I believe that is all